All right, good afternoon, folks, and welcome to the Marketplace Show Reset. I'm Anthony Weeks, and I'm joined by my colleagues who are going to be on the screen very shortly. And there they are. It is all full
Yeah.
compliments of the team on the
Hello.
screen. And I want to say pleasant good afternoon to my colleagues. Ladies, how are you doing today?
Very well. Thank you.
Yes, fine, thanks. How about yourself?
Well, I'm looking at your backgrounds, right? And look at your background and look at my background. What is wrong with that? What is wrong with that picture?
Somebody has to be in the studio, so
Someone has to push the buttons to keep it all going. And what can we say? But I always like to, well, I haven't done this in a long time, talk about the weather. It's just particularly nice today in the
Mhm.
DMV, which we are all in the DMV. Oh, Donna, I love that. You just cast your eyes over to the window and we saw that
yes,
sunshine.
yes,
Yeah,
it is beautiful day.
it is a very beautiful day. So there, ha ha,
Hey,
Anthony.
it's beautiful here too. So I just figured
Great.
that you know,
Well, you're in beautiful U.S. Virgin Islands.
absolutely.
We would hope that it would be beautiful. But are you heading into another, hurricane season moment? I mean, we're in
No, no, no. It's winding down. It's
it's
winding down.
winding down.
Winding down. I don't know if it's winding down. It better be winding down,
Okay,
wound
wait,
down
okay,
before I
okay,
get back home,
okay,
though.
okay. So according to the calendar, it's supposed to be winding down.
Yeah.
Now, obviously, some years are different than some calendar years are different than others, and
Mhm.
so we may get one or two surprises. Who knows? Hopefully not. You know.
Yeah, we've passed our most active days, which are usually around the middle of September. But I was on a call. Our head of our emergency management said the end of the active season is around October 15th. There are two storms in the coming off the coast of Africa right now, two disturbances. We'll see what happens with those. But we've been very lucky that most of the storms have passed above us or below us, mostly above. And this Sam looks like it's going to probably die out and hopefully die out in the Atlantic. Hopefully. Otherwise, Bermuda may be in some difficulty, but it's
Mm.
not going to bother us except maybe some rain and some high surf or something.
Well, that just means
Well,
that
today,
time
today,
to
today's
break.
show, today's show has a completely different meaning.
It
Uh,
does.
it absolutely does. Absolutely does. So we typically share our content on other strategic partners network, if you will,
Mhm.
cable, radio, and also satellite. The satellite is for our Caribbean Food Network, and so for years, we have been producing live content, live events, live broadcasting, and so yesterday we officially officially went live on our brand new Roku channel.
Oh, great.
And
Congratulations.
thank
Great.
you. And so for folks who are going to see us for the first time on Roku, this is the Marketplace Show Reset. This is segment number one on health, wellness, and lifestyle. Joined by my colleagues, we have the host, Linda Dorman. Co-host, we have Yvette Wood, and we also have now it's a little bit because I'm trying to figure out, should I call her a co-host? I don't know what to call her because she was there from day one when we did our first show. From the first show, report from Capitol Hill. When she said,
We'll figure it out. I could be a guest for right now. I'm not
"No,
a
no, no, you're
special
not. No,
guest.
no, no, you're not. No, you're no, 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 no." I'm trying to figure. You have a
Special
senior.
host.
You have a.
No,
You have a.
I don't have a senior
You
role.
have a senior
I can
title.
be
You're not just.
I
You're
could
not
be
just
I could be
anybody.
co-host. I can be a co-host, okay?
The
Yeah.
honor.
Don't move it up any higher than that. You're the host and we're co-hosts.
So you know, and I got to tell you, like clockwork, every week, former Congresswoman Donna Christensen gave us a report as to what was happening in Washington on Wednesdays, and then we graduated, and it went to where we were on Monday to Friday. It was grueling, 2 hours a day, and so here we are going through the different growth process, and we are now we now have our own television network, and it's now featured on Roku. And so the 62 million Roku users now have access and can watch our programming. When they subscribe, all they got to do is add our channel to their I guess library of channels, and they're able to watch us every day, every week, 24/7, 365 days a year. And so I want to welcome you to our program. We're excited about our new platform and launching. We have some great programming lined up, and so today is the first official installment of the Marketplace Show Reset, our health, wellness, and lifestyle program. And I want to thank you, ladies, for being part of this, if you will, growth process, and look forward to continued progress and forward, development in the work that we're doing.
I think growth is the actual word. This has been an interesting journey since the pandemic and launching this segment last July 2020.
Yeah, I think we're close to it. 2 years. We're getting close. Yeah.
Wow, it seems almost impossible, but we've had the consistency has been probably the mainstay, because I'm so passionate about health, as I'm sure everyone, Donna and Yvette are. But what's so fascinating is how many individuals that we have had on the program that have given us just terrific conversation, and even more so terrific and very useful information around a variety of health topics. So
absolutely. And I got to commend you, Linda, because the what you just said, the operative word was consistency. I got to commend you and thank you, both you and Carolyn, for how consistent and how committed you guys have been to this program. Like you said, I mean, it's you guys stuck with it, and here we are, almost 2 years later.
And what's amazing is that we went from 30 minutes, and broadcasting from my home with our orange notebooks, because we were taking.
That went out the window real quick. That went out the
a month later, we just figured that, oh, wow, technology will allow us to be in separate locations. Plus, it was COVID safe. And we just continued on. And then all of a sudden, you had this bright idea. Let's just do it a full hour. But we really need now. But we'll cross that bridge when we get it. We'll get some more time.
Yeah. So thank you so much. And folks, what it means that we, from time to time, when we go live, we do interrupt the normal programming on our channel. And so we do apologize, but every so often, certain shows we do live shows, and they take precedence over other shows. And so this is one of these shows we broadcast on Wednesdays and Thursdays, where we're live. And so this is what you're experiencing right now. So we apologize or excuse us for if we disrupt.
You shouldn't apologize. This is great content. I'm glad I mean, I've only been on now for a few weeks, but I've really enjoyed it. No need to apologize, for sure.
Thank you for that, Donna. Thank you so much for that, my friend. So, ladies, what's happening today? It's been incredible so far. A lot of rapid movement.
A lot of rapid movement. A lot of interesting things have occurred since our last week together. And we thought we'd come together for the last Wednesday of the month, and actually, pretty much we're going to be every Wednesday, the last Wednesday of each month, talking about topics that we know truly matter to us and our families, as well as those who listen and view in. And so this week, we wanted to really just do a little bit more of a deep dive and kind of give an update, obviously, on the pandemic and where we are with the numbers, where we always, a lot of the controversies that we're hearing in New York with the mandates for healthcare workers and educators, and what this means for workforce, the gaps in job enforcement in these areas. And those, this whole new thing that we're hearing, the
Mhm.
healthcare workers are not trusting the science. Who knew that?
Yes, imagine.
Imagine that. So we wanted to talk about that. And then we want, make a little bit of a curve turn, because we also want to talk about other areas of health that really don't get an opportunity to get the spotlight. And that is, things such as plastic and cosmetic surgeries, because they're picking up again now that individuals are able to travel to different countries for their medical tourism is increasing yet again, believe it or not. And people are having all kind of interesting elective surgeries. And I think we have an interesting topic that we want to talk about that as well. So we'll talk about the pandemic, and we'll talk about what are we going to talk about? BBL. Do you know what BBL stands for, everyone? Mm.
No.
No,
Yes.
I don't. I meant to look it up.
Oh, it's going to be interesting. I'm going to let you vet, because this was her good idea.
Body,
Yes.
body must be one part of it.
The body is, yes. BBLs are Brazilian butt lifts. And
Oh
they're
dear.
all the rage with celebrities and young women. So we're going to get to that topic right after this
Wow.
pandemic. We have to talk about what's going on out here in the world with this pandemic, as Linda was saying, about healthcare workers rejecting the vaccine. And that just blows me away as a nurse myself. I can't imagine giving bedside care and not protecting myself first.
Yes.
Right? It's kind of like a flight attendant, right? They tell you when you sign up for that job, you have to put the passengers first. It's up to you to get everybody off the plane and then yourself. And I just cannot, I just don't understand their mindset on that. Dr. Christensen, please weigh in if you'd like to on what you think the mindset is as to medical professionals rejecting the science behind the COVID vaccine.
I think it's the politics and a lot of the chatter out there, because it really doesn't make any sense. We generally take our flu shots, although I heard Sanjay Gupta say that really it was about 70 or 80% of, I think it was less than 80% of healthcare workers generally take their flu shot too. So there's something else going on, but I think all of the chatter that's out there, the politics that have gotten involved in this shot, have probably had a lot of influence, because I really can't, not only protecting yourself, but you're protecting the patients. It would be horrible for a patient to come into a hospital and you have an asymptomatic case, and that person picks it up from you. So you're protecting your patients and you're protecting yourself, as well as protecting the whole community, really, and I, I don't know how we've lost sight of the fact that we are our brother's keeper, our sister's keepers. We used to
Mhm.
have more of a sense of community and village, and understand not only that I have a responsibility to my neighbors, but also that although I do have personal freedom, that freedom stops when it interferes with somebody else's freedom. We've kind of, at some point, I'd like to have a discussion on what's going wrong with our communities,
Well,
because we've certainly seen a lot of changes.
we've seen so many changes, and this might be one of them, that it was a little known fact. It was a quiet storm in the brew, because no one would have imagined that our healthcare workers would not have applied what I was going to submit as common sense. That particularly if you are in a COVID ward or in a high risk ward like cancer, an oncology ward, or a NICU with babies who are already the most fragile patients in a hospital, and you haven't been vaccinated, one for the flu, and two for the COVID, SARS COVID 2. It
Mhm.
almost seems hard to fathom, but I think possibly from what I'm hearing from former colleagues at the hospital system that I worked in as an administrator, as an executive, so not on the clinical side, direct at the bedside, like you ladies, is that there's not enough transparency in the science that is out there. So therefore, you have dribbles of information coming from governmental sectors, NIH, CDC, local hospitals, university research centers, mixed in World Health Organization, Department of Health and Human Services for the United States. And then you add in the global departments of health, and it's hard to then filter and sort and get to the true information that is no longer part of the disinformation or misinformation stream. So there's that whole issue with allegedly there's not enough research out there. And so next is that you have a nursing corps that is fairly young that had to be pushed right through. And I think, Yvette, you've talked a little bit about that in terms of skills, not having all of that. We see I'm in my office, so now when somebody calls, they know not to do that. And so the next issue is you have quite a few issues related to just general trust. At the hospital that I worked in, it was mandatory to keep your job in order to actually have a flu shot. And so now that the mandates have come out, CNN reported two women who just were going to lose their job because they were not going to get the COVID shot. One,
I saw that.
nurse. So it's a pretty dire situation.
I'm glad that you guys, because I am probably of the group, I am the most non-clinical, non-healthcare, non-medical person in this group. And I got to tell you, I'm surprised. I thought when you sign up to be a medical professional, you understand that you are contributing to science. You understand the high level of ethics and hazards that comes with the territory. And to hear doctors and nurses refusing to take the vaccine when we're talking about a pandemic where people are dying all over the world and they refuse to do it, I got to tell you, it doesn't look good for the industry. It sends a very mixed, confusing signal. And I'm looking at that industry and saying, well, how can I trust you guys? How can I trust you guys to take care of me when you don't even have confidence in the field you're in? So why take anything? Forget vaccine for a second. Why take anything you give me?
Good point.
Absolutely. I think, Anthony, it has to touch on what Dr. Christensen was sharing with us, is what's happening in our communities as a whole. I disagree that there's not enough transparency. I think
I disagree as well.
We have been very transparent. We are dealing with the resistance. We are dealing with just outright rebellion. I just don't want to do it, even though I know what the risk is. And later on, when another broadcast, we can touch on that. I know we briefly had emails about violence, but it's like our young people. They're not afraid to die. They're afraid to live. So we have this community of nurses and healthcare workers who have decided that even if my life is in jeopardy, I will not take that vaccine because I'm loyal to my political party, my spouse, my beliefs that you're infringing on my freedom to choose. This is what it's boiled down to. And I am in agreement with these hospitals that are terminating them. I'm sorry. I am a nurse. I signed up to take care of people. And if that means taking my vaccine to protect my patients, then that's what I do. It is no difference than a police officer, than someone that goes into the military, who puts your life on the line. And these are things you do to safeguard the people that you have agreed to protect.
And that's a good point. And what my point is that that's the excuses. That's what we're hearing in the media. That's what some of these nurses are sitting, who are before the journalists, are saying there's not enough science. There was one amazing woman who did an undercover expose, and that was the issue. We can't trust what's out there. They have the same, content or rhetoric or narrative around where's the science in this, and it's almost difficult to fathom. I too don't agree. I think that there's lots of information that all of us can Google, of course, but at the end of the day, we're not scientists, so there's going to be a trust factor that has to come into this process so that you can, in fact. I also agree, because I've seen individuals get fired from their jobs because they did not get the flu shot in a mandated healthcare system that required you to receive your flu shot, and you knew that when you signed up for the job. You went into employee health, and that was the first thing they gave you. Have you had your flu shot recently? And if not, you were going to get at least get one. So if you wanted the job, you knew what it would take. Where we are right now, yes, I agree. There's a lot of political stance out there. There's a lot of ideologies, and there's a lot of individual lack of common sense that's just certainly swirling through our healthcare system. And it is difficult. I totally agree with you, Anthony. If you're not willing to have the shot, I would want to know if you're bedside to myself or my loved one, are you vaccinated? Are you taking the kind of care and precautions that landed me in the hospital? And if not, then I'm not too sure. I feel like I want you next to me delivering healthcare services, for sure.
Absolutely. And that's what happened in a lot of these nursing homes and assisted living. The residents in those facilities could not get out. So therefore, the staff had to bring it in. And we lost it by the thousands because unvaccinated staff were coming in there providing care and passing on the COVID to the residents and the patients. And it's unfortunate. It really is.
And we actually had outbreaks at nursing homes in St. Thomas that's exactly what happened.
Well, isn't that where we had in Washington State, if I'm not mistaken, that we had patient zero was actually in a nursing home? So we wonder how did it occur? And you're right, it had to have come in from someone affected through travel or otherwise. I mean, we've gone from zero patient to, let me look at the map and say, over 43, almost 44 million cases in the US alone. That's just the contiguous states of the US. With 700.
We should be counting the rest of us, though, because does it say just contiguous states? Because we do send our information in as well.
This particular rendering, it's death in the United States, and hopefully, but almost 700,000 deaths.
Yes, we've as we were saying before we started the show, we've outpaced the Spanish flu, the most deadly war that the United States had, and the deaths are continuing to grow. In places where the vaccination rates are higher, we see less cases and we see less deaths. For us in the Virgin Islands, we should not have 71, and I haven't checked today, but we lost 2 people in the last 2 days. So it's all preventable, and they were young, and we were seeing more younger people, according to our epidemiologist. Most of the cases have been, as she reported, between the ages of 0 to 17, and I think that's what we're seeing across the country, that younger people are becoming infected now. Somebody who's an infant had to get it from an adult.
Right.
And that's very sad, because I'm looking at statistics that speak to what's happened in the last 7 days. There's a 14-day trend. States like Alaska, New Hampshire, New Mexico, North Dakota, Maine, Michigan, and where I am and where Yvette is, we're in the state of Maryland. We've had an uptick as well in the surge, and this is just surge from COVID-19 or SARS-CoV-2. We add that and compound that to the normal surges you have during this beginning fall and winter seasons, with things like influenza and pneumonia. And this is not.
Maryland has been they've been doing good work. Have never been a fan of your governor, but I've really looked at some of the things that he has done from the beginning of the pandemic to kind of tailor it to the Virgin Islands, because I think Maryland has been a leader. So for you to have a surge, that's what's going to happen to the rest of us.
Tell us. Why don't you just tell us how you really feel about the governor? Why don't you just really tell us?
No, I mean, I've gained a lot of respect for him. No, I mean, I've gained a lot of respect for the governor of Maryland, and he's a Republican.
So,
And I've gained a lot of respect for him
I'm
and
gonna
how he's
share
handled
something with
the
you guys.
pandemic.
So
And
I
it's
got
1%.
an email from him last week, and I think somehow he stumbled on the Jumpstart site because our Jumpstart site is it ranks very high in the Google search or other searches, right? And so the reason for that, obviously, because when you say Jumpstart economy, obviously, if you pay attention to the economy, it's gonna be top of the mind. So I get an email from the governor, and I look at his email just to make sure I'm not, this is some fake whatever. It's the governor's email, and he went on and he actually left, really expressed how he felt about the situation. I did say I was debating whether or not I wanted to share it to begin with, but I was pleasantly surprised to get in my inbox from our Jumpstart site an email from the governor Hogan of Maryland. So that's really interesting. But here's the other thing I want to ask you guys, and I know we have the Brazilian butt lift thing that we need to talk about, but here's the other thing that I don't understand, and you guys have to help me understand this. Why the division on the booster shot? I mean, I'm hearing different voices, different position as to whether or not, when, and if we should take it, and so I need to understand that because I'm getting mixed signal from within the medical community, and then also, did you guys know? I thought when you got COVID, you got the antibodies, and so therefore, I know they said there's a possibility you can get it again, but I spoke to someone who caught COVID 3 times.
I know somebody who had it at least twice.
That was vaccinated. Both of you.
Sorry,
they eventually got vaccinated,
Okay.
but I think once or twice, maybe the first time they were not, and they got but I don't understand.
In the case I know, they were not vaccinated at the time, but they thought they had antibodies. But I think every time I hear somebody on the press saying there's confusion, I kind of wonder what is the confusion. The director of CDC, and I must say that sometimes I've been disappointed because they've created some of the confusion along the way, but she actually followed what the FDA said, and that's the final thing. So, and at the point at which her advisory committee said no vaccines for those people on the front line, I went on Twitter and I'm saying, are they crazy? What do you mean? People who are exposed to people every day were not included in those to get the booster. And all she did was include those in addition to the people in nursing homes, those over 6, is it over 75?
65.
Over 65. She's been very clear, and that's where it stands. Those people who have compromising diseases, who are more vulnerable, and that can go from 18 and up. So this shouldn't be. Did I miss any category? I probably did, but
No, I think you touched on, and I think in that question is so valid, but it speaks to how we are disseminating information and how it's getting entangled with just the first vaccine, the first 2 shots, and then now we're talking about a booster. It almost casts doubt on the efficacy of the actual vaccine to start out with, but people need to understand that the booster is the potential of it being every year, potential of us having the flu shot every year, it's in the same category of response. We have to think about it long term, and I think people can't get past the immediate right now. So getting a booster, because I'm going to get my booster.
The other vaccines. Also, I mean, some of them you don't have to take for 10 years, and you have the flu. But one of the things that I think people need to be reminded of, and I try to do it if I do radio, is that we're dealing with something we've never had around before. We're dealing with something totally new, and we're learning as we go because that's all we can do. This is a new phenomenon, a new virus, and we did really well on coming up with the vaccine that's not 100% protective, but it's protective from um, severe disease and death. And it's the best thing we have in terms of prevention. And we should all take advantage of it because that's where we are right now. But I was saying, for example, that I was sure that eventually Johnson and Johnson would end up with a booster. We'll see. Maybe they won't. They're still, um, the last I heard, Moderna and Johnson and Johnson have not shown that it requires a booster at this point, but they're studying it. They're studying it.
Absolutely. And consider the COVID like the flu. Remember, we have different strands of the flu. We have different strands of COVID. So when the vaccine first came into conception, it was focused on the strand that was killing everybody at the time. Now the COVID has evolved. We've got Gamma, Lambda, the Mu, it's going on down. It's consistently changing. So our vaccine will have to change as well. And I don't think people are giving credence to that with wanting the booster. And they talked about that in the efficacy when it first came out. If you guys remember, that was the big thing with J&J. They were saying J&J was not as effective against the alpha, but more effective against the variants. And I had this conversation offline with Anthony. I've been saying from day one that I believe that everyone should get the Pfizer and the J&J, Moderna and the J&J, because then you have that overall protection as much as we can get at this stage. But you're absolutely right, Dr. Christensen. It's science, and science is always evolving. And if people can get that through their heads, then they will be able to understand this process better. I mean, this process started with measles, mumps, and rubella vaccines, but nobody took the time to go back and do the research. But it was the same exact thing until they perfected it.
As well as things like shingles, where you can walk into your local drugstore and have a shingles shot if they have a Mediclinic. And I remember contracting shingles. We didn't have shingles vaccines back then. So this has become this has just been so clouded and so muddied by political issues and party lines. The other thing that's very concerning is the fact that we're producing millions and millions of doses that actually are not being shared globally, where we can share them, where there is vaccine disparity and access to it free, where we need to be more of a global citizen. I know that we have sent millions across the pond and here and there, but yet we still need to do even better and make sure that we work very extensively with our global partners where they're not producing their own vaccine.
And if you notice, many of the new variants are developing in states or countries where the vaccination rate is low.
Yes.
And so makes it more incumbent on us to make sure that everyone around the world has access to vaccinations.
Particularly,
well, I'm glad that you said that, because this allows me to segue to what I sent you guys. I think I sent it to you guys last week, and the title, the headline said, "Another virus has arrived, which is 70% more deadly than COVID-19."
I saw that.
Yes.
India is not considered a low vaccinated country, is it? It says India is rushing to contain the outbreak of a virus that has claimed the life of a 12-year-old boy and is even deadlier than the COVID-19, and it's called Nipah virus. Last week, the boy was taken to the hospital in southern Kerala with a high fever and a brain inflammation. After tests, he was diagnosed with Nipah virus and died on Sunday. Officials quarantine and hospitalization on 188 people using contact tracing to prevent a widespread outbreak. Experts believe that the Nipah virus has the potential for the next pandemic.
And it's hard to even wrap my head around another pandemic. There's not one global economy, small, medium, developed, industrial, sophisticated, that can manage economically another shutdown.
Oh no, no.
It's
And Anthony, I just looked it up. Only 16, a little under 17% vaccination rate in India. I mean,
Wow.
there's a lot of people to
Wow.
reach.
That
There are a
is
lot of
that
people
is
to reach.
horrible. That is horrible.
Yeah.
For a
yes.
country of 1 billion people.
Mhm.
But but that's the disparity in access to healthcare. Pfizer absolutely has boots on the ground in India because India has a very high diabetes rate and they have an amazing diabetes drug in India. So you have to start asking yourself, where is the follow the money, not the science, but follow the money and find out exactly what's happening and why are we not sharing what is going on
I,
in the nations.
you know, I'm on an AIDS board, and I remember back when AZT was first developed and being used for AIDS. It was one of the early treatments,
Mhm.
and we argued and advocated for licenses to be shared globally so
Yes.
that they could be made across the world, and we were able to get that done. Um, and I think the same thing needs to happen. There's a lot of resistance to, I forget what the proper term is, but sharing those licenses so that other countries can have the expertise to develop the drug. And, you know, we may have to do that. This is a pandemic. People are dying worldwide. And the thing, without the vaccination rates going up, we will continue to have mutations. And at some point, I wish they would just mutate their way out, but they're probably going to mutate to be more resistant to the vaccines that we have, and we'll be playing catch up. And I can't see any way out of this right now.
All right, we need to take a break. We're long overdue for a break. When we come back on the other side, we will get into the BBL,
Yep.
Brazilian butt lift topic of discussion. I know nothing about this topic, so
It's interesting. I was out to dinner, and I think that topic came up last night. That she didn't call it that, but yeah.
Okay. All right. So, folks, sit tight. When we come back, we're going to have an interesting discussion on the Brazilian butt lift issue. This is the Marketplace Show Reset. This is our segment number 1 on health, wellness, and lifestyle. We'll be right back.
vaccinate yourself, now we go. If you from the VIs and you want to get vaccinated, put your hands up high. The life you save might be your own. If you from the VIs and you don't get vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together. So we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in the United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, here we go.
To do this because
Yes.
break there was this wonderful, and I'm just hoping
I know. I was
the time, and then I'm thinking, wait a minute, that's adopted locals to the U.S. Virgin Islands because I'm vaccinated and I want to put my name in and try for that.
Is it just me or I'm hearing you in and out?
You're hearing us in and
Is
out?
it coming across?
We can hear you perfectly great. Dr. Christensen, we can hear you.
Okay, then it's my computer.
So that was wonderful.
Go ahead.
That's a great campaign, a very important one. And we should have that across the country. We should pair that up with our national lotteries, our Powerball, our Mega Ball, or Mega Millions. You know, that's.
Did you see the governor?
Yes.
I saw the governor. Yes, in his jeans and white shirt. And I'm telling you, I was popping along. I was like, oh, where am I? So that might be a good segue. We kind of, had a long segue, a long conversation about the pandemic, about resistance to COVID shots, particularly within the healthcare workers. That's not the only thing happening in healthcare. We still have all the other surgeries, all the other treatment requirements, all the other emergencies that individuals experience that we need to think about. And even all the elective surgeries that individuals engage in just to make themselves feel good. So, Yvette, why don't you start us out with this amazing conversation? Because see, I have a natural situation that doesn't require that. And I'm the envy. If you ask Carolyn, she Googled it all the time. And it was kind of like, gee, Carolyn, but she told me she was envious. I was like, it has its problems, but I don't have to spend the thousands of dollars to have a voluptuous backside. Let's put it that way.
Absolutely.
Yeah.
So I have a visual aid. Okay, guys, can you see my book? It says, I need a new butt. Can you guys see my butt? I need a new butt, new butt. So the conversation started with my 28-year-old who decided that she did not like her butt. And I think she has a beautiful butt, but she wanted a different butt. So lo and behold, we're walking through the airport in Charlotte, North Carolina, and there was a young woman who had her face on the chair. She was on her knees, and and I'm like, Megan, why is she sleeping on her knees? I said, that's just gross to me, to have her face on the seat where everybody sits. She says, well, Mom, she can't sit down because she just had a BBL. And I said, well, what's a BBL and why can't you sit down? And so, of course, I became fascinated with this topic. And then I looked at all the celebrities who have had BBLs and how popular they are and how people are traveling to Mexico and to Turkey and to Miami. And then I became horrified when I realized you don't have to be a board certified surgeon to perform this. And then I read that people were getting Fix-A-Flat injected into their butt by going to these.
Whoa. Fix-A-Flat? What, as an entire Fix-A-Flat?
Yes. Tire Fix-A-Flat. Yes. Because they were going to all these kooks dying to have the perfect butt.
Yeah, so let's talk about because someone very famous, she has a little say that person. talks about the fact that she had an injection. You know, they have these injection parties to be able to do these pump up the bottom versus an actual surgical lift, meaning liposuction out, repositioning, resculpting, and reducing your waist, which is part of the process. Very dangerous, wouldn't you say? I would say that it's very dangerous to get these injectables, particularly if it's someone that you don't know and certainly not certified.
Absolutely. And then on the counter side of it, the hotels in Miami are now complaining because all these women are converging in Miami to have the surgery. And when you do have the surgery, listeners, viewers, hear me. If you have a BBL, please find a place to recover. Do not try to go and spend the night in a hotel and then go home. The hotels have been complaining because people are checking in and they're draining all over the beds from these BBLs. And it's not sanitary and it's not safe. You need to be somewhere that can take care of you. And they do have recuperating homes that you can go to recuperate after you have a BBL procedure. I mean, this is all the rage. They range from $3,000 to $25,000, depending on where you're going to get it done. But I'm encouraging you to embrace your own beauty. I mean, all of our bodies are unique, and it's okay to want something that you don't have. God knows there's a ton of things I wish I had, but I've learned to fall in love with what God has blessed me with. But this BBL, I wanted to talk about it today because it's so popular, and I didn't want anyone to run off to improve their backside and end up dying because they chose to do that by not investigating the places they're going, that these surgeons are certified, board certified to do BBLs, and not some pediatrician or chiropractor that has decided they want to do it, or worse yet, Sally Sue putting Fix-A-Flat inside of you in the back of a nail salon.
See, this is where I struggle. I struggle with this because these are the same people. Remember, we had that conversation about the blue pill and the reluctance and the resistance to taking the vaccine, but they're willing to take the blue pill and they have no clues what's in the blue pill.
Correct.
Why are they willing now to put their lives at risk, their health at risk, for some vain vanity reason? Because they don't like how it looks, but they're having things done to their body, chemicals injected into them, for the purpose of just pure vanity.
Well,
help me to understand that these are the same people that are saying no to the vaccine and not want to put that in them, but they're taking this risk and going to not certified, like you said, people that are not certified, people that are just hanging their shingle on the door and providing the service, and they're really not certified to do that, and you're putting your life at risk there.
Absolutely.
Well, you'd be surprised. I read something quite interesting that spoke to the fact that the backsides of slaves, particularly slave women that were quite endowed, there was quite a fetish, and people would pay to come and see them. So Alicia Gaines, who's a professor of English at the Florida State University, and she's an author of this book called Black for a Day, White Fantasies of Race and Empathy, talked about how people like Kim Kardashian, and who has a beautiful figure, but has been alleged to have augmentation. Nicki Minaj, again, alleged to have augmentation. My goodness, others have alleged to have augmentation if they've not been forthright. That they have made a ton of money putting those images out there that our young women and our teen girls in particular want to emulate. And then you have those women who are mature, who have the finances, who have the desire, who say, I'm going to do self-care. And self-care may include cosmetic surgery. I want a nose job. I want a chin lift. I want a breast augmentation. And why not? I no longer want something flat or saggy or whatever the situation may be that's getting them and driving them into having what we've come to know as the Brazilian butt lift. It's quite an interesting story, but this is not new. It's just gained a lot of notoriety because of the medical tourism that allows you to travel to Brazil, to the Dominican Republic, and Mexico.
We don't have to travel too far here in the Virgin Islands. We understand a lot of folks in the Virgin Islands go to the Dominican Republic.
Right.
That's a popular destination to get that procedure done. So, we don't have to go to Mexico. All we got to do is go to the Dominican Republic.
Listen, there's a survey that the International Society of Aesthetic Plastic Surgery found that since 2015, the number of butt lifts performed across the globe have increased by 76%, almost 78%.
Wow.
Yes.
I missed most of the conversation. For some reason, I was having connectivity problems. I'm back in now and clearer. So I'm going to listen. I can't comment on anything.
How convenient! You don't want to touch the butt conversation.
It's funny because I was out with a friend, a lady friend, and we were talking about an artist who was recently in the news, and she was saying, her comment was, she better just shut up unless we otherwise we'll start talking about her butt, cosmetics or whatever, her butt lift or whatever. So it's funny that we're talking about this today, and you might know who I'm talking about.
I have seen this thing go the other direction. I've seen women whose butt has been deformed now.
Yes.
Yes. And
I'm looking at it. I'm like, do you know how that looks? It looks weird.
Well,
some of the surgeries, wherever they're done, have not all gone well.
Lots of them, there's a lot of risk. There's a lot of danger, and there's a lot of need to contemplate whether this is actually right and for the right reasons. So, Yvette, can you share some of those risks associated with a Brazilian butt lift and any elective cosmetic surgery? But in particular, we're talking about BBL today.
Sure, absolutely. The first thing is do your research. Make sure you have a board certified surgeon. Surgeon is the key word here, because again, in some states, you do not have to be certified to do this procedure. You want to check out the facility that you're going to have it in. You want it in an outpatient clinic or an ambulatory center. You do not want to just go into the average doctor's office where they don't have the crash cart or the equipment to take care of you in the event of an emergency. You want to ask how many times they've done this procedure and what is the success rate. One of the things is botched BBLs. They can botch your surgery. They're trying to move your body fat from one place to another, and sometimes they make mistakes and you end up being disproportionate, which is a nightmare because it's not as easy to fix as you think. You can have bleeding. You can get an infection. You can they can move fat deposits they're supposed to be moving them from other parts of your body, but they may have issues trying to move fat, say, from your abdomen to your butt, and you end up with tears. So it's not as cut and dry as you think. People think, oh, I'm going to hop on this plane and go to Miami, and I'm going to come back and I'm going to have this great butt, and my whole life is going to change. I also recommend that you get counseling, because some of it is image disturbance. You really want to get counseling before you do something like that. Just because you have a BBL doesn't mean your whole life is suddenly going to be perfect. You're still going to deal with the same issues you were dealing with before mentally. Yes, you may have a different physical appearance, but sometimes we have surgeries for the wrong reason. So I do encourage you to talk it over with a licensed counselor as to why you feel you want to make a change like this to your body. And then Linda, you were talking about why people do this. And Anthony was saying, and they won't get the vaccine, but I'm looking at it too. Some of these women are using student loan money. You're not paying your bills, but you're going to go have a BBL and you got to pay your rent and your car and take care of your kids. This is why we need to talk this over, because that's just not wisdom to just say I have a bigger butt.
But also,
psychological.
I think one of the other risks is the fact that people really need to understand that there could be such severe skin irregularities, meaning that when you move fat from one place, it was intended to be in that one place, because isn't fat different in different parts of the body?
Absolutely.
I would think so.
So if you move something there, you resculpt, there's a chance that it could, what I understand for those of my friends who have had breast augmentation due to cancer, that it can die, for lack of a better word, and create a significant dimpling where you have to obviously go and have follow-up surgery to make that correction. And then you're in a cycle of fixing and hoping and waiting. And then what's the long-term effect? I mean, you're not going to, be bouncing around looking like this at 90. I mean, sometimes we just have to accept what we got.
Absolutely.
Side effects.
That's the best advice.
Absolutely. And that's why I had started with my little trusty book here. I need a new butt, because at the end of it, I mean, it's animated. I bought this for my daughter, but at the end of it, he decided that he had the best butt of them all. So he didn't need to go get a butt. And so sometimes we just need to be thankful for what we have, walk in the beauty of what God has given us, and you will discover that you really don't need a BBL. You're just perfect the way you are.
And for those people who are going to hear that, receive it, accept it, but still make their appointment, please follow Yvette's advice. Please follow Yvette's advice. Make sure that you are a competent patient, that before you even have anyone touch your body, it's very critical. And then be clear. Is this as far as you're going to go? I mean, there are a lot of women who get tummy tucks because they're having the mommy tummy tuck, and we understand. And so in the same vein, we have to appreciate that segment of the population of women and possibly even men. So, I mean, this is not exclusive. That there actually is, they're very contemplative. They've gone through all their psychological assessment, and they have it, and they can afford it, and they've done their research. Then okay, go for it. We applaud you for having that level of self-care. But we want those who are walking as individuals influenced by artists or influenced by culture that says you must have this in order to be a complete and whole person. We know that that's certainly not true.
Absolutely not. I did find out during this research, Anthony, that there is a procedure where you can get a 6-pack.
That's right.
One sitting. You can get that instant 6-pack, and I'm going to tell you guys the truth. My mind was like, aha, I can get a 6-pack.
I'm good. I'm good with me.
You're good with me. Well, there's a lot that you can get. I mean, if we're going to go there, you can get some of the major muscles that you're seeing these buff guys get, including that 6-pack.
Yep.
You hear me? Sometimes we
good.
don't know what's real and what's not real. But
exactly.
But we just want people to be really mostly informed. We understand these are lifestyle choices, and that's why we wanted to put this in as part of the segment, because part is health, wellness, and lifestyle. That if you're going to make this decision as it relates to your lifestyle, you're going to go this far, and you're going to absorb all the risk that goes with it, including death, then at least make sure you have all your information well established and you're confident in what you're doing.
Make an informed decision.
Death and deformity.
Absolutely.
Being deformity, huh? That's
deformity.
Not a good look. Not a good look. Well, folks, we've come to the end of the show. It's been time flies when you're having fun, but thank you so much. This was our, if you will, debut inaugural showing on our Roku channel for the segment on our health, wellness, and lifestyle. Thank you, ladies. And folks, coming up next is the segment on business, economy, and public policy. We're going to feature a piece with the Small Business Administration and Vice President Kamala Harris talking about celebrating small businesses. So coming up next, stay tuned. We'll be right back. Ladies, we'll talk soon.
Have a good day.
Thank you. Bye-bye, everyone.